Okay, hello. I'm speaking for a few moments with Dr. Mysorekar, who is the president of the Hindu Temple Society of North America, as well as a practicing physician and obstetrician gynecologist. So I have a couple of questions, Dr. Mysorekar, both as a physician and as a religious leader. So first, I wonder, as a physician, what role do you think faith leaders or chaplains can and should play in end-of-life care or in working with patients who have advanced illnesses?
I think physicians must have some knowledge of spirituality, whether it is belonging to their own religion or otherwise. And of course, it's also said that one doesn't have to be religious to be spiritual, but that's kind of controversial. But however, at least you should have a spiritual mind and patience to listen to the patients, to at least appreciate their thoughts, their thought process. As a spiritual leader itself, you can have spiritual leaders who are non-physicians. I think they certainly will play a very good role in acting like mediators between the physicians and the patients. And the spiritual leaders give an uplift to these patients who are in their terminal illness. And in my opinion, that is an extraordinary sense of support and really needed for a smooth transition of the final few days of this dying individual.
So it sounds like faith leaders can work to educate physicians about
Yes.
spirituality.
Absolutely.
And then also work, to bridge the gap maybe between the physician and the family.
That's correct.
So I was really struck in your comments at the conference, you talked about in the Hindu community specifically the importance of family elders as faith leaders,
Yes.
not just the ordained priests or chaplains, but the family members themselves playing a spiritual role.
That's true.
How do you see that, the importance of that?
It really plays a tremendous role. When I was in India, I used to see only elders be sitting by the side of the dying person. Or if the person is already very old, certainly some Swamijis, what we call, spiritual leaders, they would come, sit by and chant certain names of the Lord, mantras, and to soothe the effect and talk about a few spiritual things. But here in this country, of course there are temples and priests are available to do this, but in many cases it is the elders of the family who seem to be doing and do very well. And the reason for that is elders, especially if they are spiritual enough, they can give a lot of support to the dying person, especially if the person is young, and can give a sense of support to say, look here, you don't have to worry about anything, we're all here to support. And that is communicated in so many different ways. And if, of course, the elders of the family are not available, they do fall back on the spiritual leaders, including the priests, the Swamijis, and many others. And I think this new concept of chaplaincy or chaplaincy courses is excellent. And I really strongly believe that this will alleviate much of the deficiencies. And in fact, a lot of us in the temple, I know they're all interested in taking these courses.
Chaplaincy is something that's not just open to ordained clergy, but that can be open to any
Regular or common
interested
people.
person,
Yes.
elder in the family,
Yeah,
or just a member of the community.
So I think, basically what you need for such is a little bit of a spiritual mind, and then to understand, to be passionate, and to be loving and caring, and this automatically the rest of the things will fall. I mean, if you disregard the fact that, today I'm just wonderful, what do I care about someone else, then nothing will work. But you have to put yourself in that place where the person is so sick and just counting days or hours or whatever. I think then one will appreciate the fact that spirituality is so very important, and the amount of comfort it gives is almost beyond description in words. And I think that has to be emphasized. Physicians must be given courses in this, and if they don't have the time, at least appreciate the fact the patient needs, and then the patient be given, the family should be given proper references where they can get. For example, I know at the temple we receive some calls, let's say from some of the big hospitals, saying that we have a Hindu patient who is dying, can you send somebody? And they didn't know anything about this until somebody comes and says, why don't you call a priest from the Hindu temple? So then one of our priests will go and do whatever that is required. So I think this needs to be publicized even more. Then all the faiths should be available. regardless of which faith they belong to, so that every patient gets equal chance to share that spirituality with their respective spiritual leaders.
Can you say a little more? You just started to talk about this in the sense that you get calls at the temple
Yes.
from medical professionals that need the help of a Hindu
Yes.
chaplain or community leader. But can you say a little more about what kinds of relationships you see between the medical profession and the Hindu community? Some of the panelists just now pointed out that sometimes there's a little more of a gap and a little more difficulties with non-Abrahamic traditions that
True.
maybe don't get the same level of respect or acknowledgement. Have you seen that problem?
Yes, of course I have seen it. Physicians don't call at all. It is probably either a chaplain or a nurse or somebody who calls and says, look, we have a Hindu patient. Do you think the patient's family wants some kind of a spiritual help? Do you think you can send somebody? And it is, sometimes it disturbs me to think that they waited that long, because I think the individual could have used spiritual care even a few days earlier. I think the reason for that is, first of all, there's not much attention given to non-Abrahamic faith patients in terms of their spiritual need. Number two is, even if they so desire, they don't go to the extent to find out where they can get it. See, sometimes the families, they also know the families. If the families don't know, I think it's the social service department which must help them to find appropriate spiritual help. But I think this is lacking considerably, and for some reason non-Abrahamic faith is not getting as much attention as the Abrahamic faiths do. And regardless whether it is one patient or 100 patients, each one's spirituality is equally important.
On the positive side, could you give an example of a very good working relationship that you've seen between medical profession and Hindu community, working together to care for Hindu patients?
Yeah, I tell you, in the New York Hospital of Queens, which used to be the old Booth Memorial Hospital, they have introduced a chaplaincy course, and they have a lot of Asians there, including Hindus and Chinese. So many people are there as patients, and as well as in the medical field. And I have seen there is a distinct transformation that they begin not just to by the spiritual help, but also by dietary needs. See, when I was practicing, there was no way they could have gotten vegetarian food in the hospital at all. But today, almost at least hospitals in Flushing, I know, they all provide the dietary needs to the patient. So I think we have come a long way. I'm sure in the next few years things will get even better. Perhaps one should make efforts to do it even faster than that, because the spiritual need is almost a dire necessity.
One last question, and thank you so much for your time. Can you say a little more, what do you think is valuable, or what's the benefit of having a group of religious leaders from different traditions, come together at an event like the Marshall Meyer Retreat to talk about this? What do we gain by addressing this issue on an interfaith basis through the kind of conversation we're having today?
I think it helps us to understand each other's faith better. And if, as a spiritual leader, I come across, let's say, a patient who is non-Hindu and belongs to one of the faiths that we just learned, at least have some knowledge, and then be able to communicate to the appropriate person to come and give the needs. And I think it also is necessary that every faith has its own way of looking at the life and death both. And in death, when we all believe that the soul departs from the body, and really death is just one of the aspects of life, the Hindu thinking is very different from others. However, if you understand how especially the disposal of the dead body is done in some other faiths, it makes you understand and appreciate how each one looks at the traveling of the soul to the ultimate region. And then perhaps you can, even when you talk to non-Hindu patients, perhaps you can even communicate that even in a better way. So this is a sense of knowledge and education even for us. Even as spiritual leaders, they all need to continue to have their CME courses, because everyday things change and technical aspects change, and we all should be fully familiar how best to deal with this. For example, let's say ending these artificial ventilation, it's a tough question. Organ transplant. And there have been a lot of controversies among Hindus. Some Hindus believe religion does not allow. I personally don't think so. I think Hindu religion has no restriction to that whatsoever. Organ transplant is perfectly acceptable. But then, if there are spiritual leaders who will come and guide this to the dying person or the family, they become torn in between the two. So we have to understand exactly what the situation is and accordingly, appropriately deal with it. And I think the patient's immediate family are already in distress, and these kind of things shouldn't be discussed with them right away, because I did give a talk at the organ transplant center, and I advised them, see, they want young people, when they die of accidents and so forth. But the family is already so distressed, you go and talk to them about organ transplant, unless they're so broad-minded, they will say, forget about it, we're not going to do it. But some other members of the family, if you talk to them, they'll understand it's not only that the young person, or the boy or girl, whoever is gone, but his or her life has become useful. And I think in some fashion, you should be able to talk to them. So this kind of understanding of one's own faith in a depth and other faiths helps a great deal in treating and dealing with patients at their terminal illness.
Thank you very much. Again, it's been my pleasure to talk about these issues with Dr. Mysorekar from the Hindu Temple Society of North America. Thank you.